Hello, my name is Dr. Shorouq Motwani. I'm a pediatric psychiatrist working with SNEH. In our practice so far, we have come to understand that there is a common misconception. We have dealt with it, the general public deals with it, and it's often a question that's asked to me at the outset. Are you a psychologist or are you a psychiatrist? When I clarify, the next question is, what's the difference? What's the difference between a psychiatrist and a psychologist? Why are we coming to you versus going to a psychologist itself? It's pretty simple. It can be anyone who becomes your first point of contact. You can go to anybody. The idea is to take professional help when the time is right. The difference essentially between a psychologist and a psychiatrist is such. A psychologist becomes either someone who deals with you in talking. They talk to you, they help you understand your emotions, they help you process those emotions and lead to better coping mechanisms. Essentially, what they do is called therapy or counseling. Now, there is another kind of psychologists, the ones who help you undergo certain tests to understand your mind better, for their sake, for the psychiatrist's sake, and for your sake. A psychiatrist is someone who is essentially a doctor. That person has gone through their MBBS degrees and then done a post-graduation in psychiatry. They are equipped to not just diagnose, they are also equipped to treat you with medications. Now, the idea that medications are going to be prescribed to you as a patient creates havoc in most families. It's something that most families or patients want to avoid as much as possible, so they will tend to go to a psychologist. There's nothing wrong with that. The idea where medications do come in, or when the concept of treating it with a combination of medications and therapy entirely depends from situation to situation or the severity of the problem. Let's say you have certain traits which have come to be understood as you going through depression. If it's somewhere where it has just started to affect you, where it's affecting you in a mild degree, where you're still able to go on and do your day-to-day activities, but are feeling a pinch, therapy might be the answer. However, the answer will be given to you by a trained mental health care professional. It can be anybody as long as you go and seek help. If your situation goes on to be a little more complicated than that or a little more severe than that, then a psychologist and a psychiatrist together or independently might advise you to take treatment with a combination, medications and therapy. The combination will work best in providing you with faster, stronger and more long-term recovery. So the final say here is that it doesn't matter who you go to as long as you decide to take help from the right professional. Thank you.